PPE.
Then you're going to identify your patient by looking at the name tag. You are going to tell your patient what you're going to do. Miss Brown, good morning. Good morning. How are you? I can see that you're happy. Look at that big laugh. I'm Nurse Lindsay and I'm here to change your old dressing. Okay, is that all right? And she would say yes. Now, if it is on a bed, you're going to need protector. I'll already give you the equipment that you need. You need cleaning solution. I have two here. So you can use the saline solution. Saline is sodium chloride. It is a type of water and salt. Good?
Okay.
So this is what we use. In the hospital, this is what we use to clean the wound. Good? At home, you might not have the saline solution. So at home, you can dilute the hydrogen peroxide to clean the area. So any one of them. Yes, it has to be diluted. If it is not, it can cause further irritation to the wound. Okay? If you use it raw like that, it can cause further damage to the wound because it's kind of acidic. And it burns. So you have to dilute it.
Yeah,
so I'm going to have my two kidney dishes, one with wet, one with dry. Well, this is going to be the wet and this is going to be the dry. You're not supposed to be moving wet over the dry. That is going to be contamination. Then you're going to have your dressing solution. I am using iodine, but we have the betadine, we have the black dressing. So you want to have a type of dressing. This is what gonna promote healing. So without this, the healing process is going to slow down. So the purpose of the dressing is to promote healing. Okay?
Yes, miss.
And then, so this now, guys, we're going to have another two kidney dishes. One with, it's gonna be the wet, and then dry gauze. So what I'm going to do is to pour my iodine on my gauze. So you're going to have some, like a little bit. I'm not going to use a lot because they're very expensive. So this is how it's going to look. You pour, you wet the gauze, okay? The one that I'm going to apply on the wound is going to be the wet one. So you would have your kidney dish, all of the gauze in this kidney dish, you would pour the dressing solution on it. Is that part clear?
Yes, miss.
All right. And then I'm going to, I did say that if it is on a bed, you're going to have protector. So you don't want the wound to drain and contaminate linens or elsewhere. Before I put, if it is, like in the hospital, they would have a dressing table where they would place their hand on. So you would ensure that the area is sanitized. So you have to clean the surface. Clear on that too?
Yes, miss.
Alright, so let's begin. Oh, did I say disposable bag? And that would be a biohazardous bag. So the bag that we dispose of the used dressing in is called a biohazardous bag. The bag must be looking what? Red. Or have what?
Red
biohazardous symbol.
Yeah.
So I'm not just going to just dispose all dressing in any bag. We put it in a biohazardous bag because this is termed infectious. So the first thing I'm going to do is to remove my old dressing. Now guys, a lot of times what happens is that the tape is going to be stick to the skin. So the cotton that is soaked in cleaning solution, or you can even wet it with water, and that helps to remove the old dressing, the tape. If you don't do that, sometimes when you're pulling the tape off, then the patient flesh come off, or it can cause further irritation to the wound. Not only that, but some persons, the skin hairy.
Yeah.
So as you remove the tape, it causes discomfort there. So to prevent all of that discomfort, you can use a cotton soaked in dressing solution or have it wet with water, and you use it to get the tape off. So that's what I'm going to do, remove my old dressing. And when I do that, so this is just the simple dressing. I'm going to show you how to clean a surgical wound after this. always hold the outer part of the old dressing, and then you can dispose in your bin. At this time, I am going to remove my gloves. I'm going to change it. I have to save that one for the other one. So guys, change your gloves, apply clean ones. So I have on the clean ones. At this time, the first thing I'm going to do is to clean the wound. So when we're cleaning the wound, we clean from the inside first, and we're going to clean in a circular motion once, and then discard. You know why I would clean in a circular motion and not long strokes?
I will spread, yeah, long strokes, I will spread.
It is what? Why should we clean the wound in a circular motion? It promotes what? Blood circulation. And once blood is at the wound, then it also aids in healing, because in blood you find what? Platelets. In blood you find platelets, and the function of platelets is to aid in healing. So when you clean in a circular motion, you're promoting blood flow. Good?
Yes, ma'am.
So again, we clean in a circular motion, and you're going to clean until the area looks pink and pretty. So some wound is going to look necrotic. When I say that, you're going to be seeing dead tissues. You might be seeing some black looking tissue or some greenish looking tissue. You have to clean it. You can't just clean it and leave it. You have to clean it. You have to get rid of it. Okay?
Yes, miss.
Yeah. Next, after you clean inside of the wound, you're going to clean outside of the wound in a circular motion, and then you discard. Ensure that it's properly done. And then you're going to get your dry cotton, and I'm going to pat dry the inside, dispose, get another clean cotton, and I'm going to pat dry
the
on
outside.
the outside and
Discard.
dispose. Now before you apply the dressing, you have to note the size of the wound. So at the end of this procedure, you have to document the size. We have the scale. We have a measuring scale where we can put and measure the size of the wound. All right. So the size of the wound tells you if it is healing or getting worse. If it is getting worse, the wound is gonna get bigger. If it is healing, the wound is gonna get smaller. So you have to look at the size, document the size, the depth, how deep the wound is. You have to measure that too. The drainage that you see coming from it. We look at types of drainage. We look at serous, and serous mean what? Clear drainage. So if you see a clear drainage coming, you have to document it. And we look at sanguineous. What does that mean? Bloody drainage. So you have to look and see if blood is coming from it. And we look at serosanguineous. What does that mean?
Clear.
You're seeing water and blood coming from it. So you have to document the type of drainage. And then the odor, you also have to document. So if the wound is healing, you won't find a high odor. But if it is getting worse, it's going to give off a stench. So you document all of that. Now at this time, now that I clean it and dry it, what I'm going to do is to apply gauze that have the dressing on it. And remember that the dressing is to promote what?
Healing.
Healing.
Miss, when a soap, I hate see it. I can interest
And it's soap. Well, they have to put in enough, because as I said before,
Depending on
iodine,
it.
betadine, black dressing, and the list goes on. They are to promote healing. So you want to have enough on it. Alright? After you do that, then you're going to apply a dry one. So you're going to, if you apply this dry one and the dressing soak through it, or maybe the wound is bleeding. So if you see blood coming from it, what did I teach you?
Don't remove it, apply another
Not to remove
one.
it, but to add more to it. Alright, so I noticed that that is not happening. So at this time, I'm going to get my tape. On the tape, you are going to write the date. So you have changed the dressing today, you write today's date, and the time that you change it. Can you tell me why I would do that?
So if a next person come and decide to change, they get it and they change it.
Right. You don't want the next person shift to come and ask you, and when you change it, and what time you change it. You need dressing now? No. To avoid all of those questions, you're supposed to write the date and the time that you change it on the tape and sign your signature. so that the nurse will know who have done it.
Mm-hmm.
Clear on that too?
Yes, miss.
So this is what I'm going to do. Your dressing tape should be the same size. It should be the same size. So you don't want some of the tape longer than the other. I'm sure you have seen the nurses doing this in the hospital. We put it on the side of the trolley, ensure that the trolley is sanitized, because you don't want to contaminate the tape, the dressing tape. I prefer this one.
Some of them nurses, when they do dressing, they do it too big. Extra, some little cut and some big old bandage.
That is to prevent contamination. So as I said, that the dressings should be of the same size. You don't want some longer than the other. So what I did was to measure the dressing tape, ensure that they are of the same size. So I'm going to cover everything. And as I said, I prefer the big tape because it covers everything.
It's simple for sure, though, miss.
Hmm?
It's really simple.
It's very,
It's really simple.
it's simple. Want
Yeah.
dressing?
Yes,
It
miss.
is. All you're doing is to clean it, dress it.
Yeah.
Yes. So guys, if you are using the smaller dressing tape, ensure that all corners are sealed. So you would have to put a tape right here, one over here, one here so, and next here. So you're going to, if you're using the smaller dressing tape, seal all four corners. And ensure that the tape is on what? The same size. You can't have some tape longer than the other. When you put it on, how it gonna look? Gonna look untidy. Alright, so we have to be very neat as much as possible. And then ending procedure, we're going to clean up our work area, put aside, towel in, disposable laundry hamper. Dispose your gloves, and then you're going to wash hands and make a note of what? Size of wound, depth of wound, color of wound, odor of wound. Good? And that's it. Leave your patient comfortable. That's it.